So we're going to be talking about IV sedation done by the dentist. And then you also have IV sedation done by a CRNA or a nurse anesthetist or a dental anesthesiologist. So in regards to the IV sedation done by the dentist, what we can do here is we can use a couple of medications that are very good sedative medications that affect you very quickly, but then also wear off very quickly, and they all have reversal agents to them, and they have an amnesic property to the medication where you can forget a lot of the appointment. So what it really is there for is there to keep you comfortable. Most people are in a very close level of slumber or sleep when we sedate them, but that's not the intent of a dentist-administered IV sedation protocol. It's there to have a long appointment or maybe a wisdom tooth appointment where there's going to be some pressure in some areas, feel very, very short. And for anything that doesn't feel good or might sound loud, you're not going to really be aware of it. So the dental IV component, we use a medication called Versed, and we use a medication called fentanyl. Sometimes we'll use a medication called Precedex, but also by definition, if we put the IV in and we give you the medication, it's effective right away because it's in your intravenous system. So that's the goal, is being able to get you comfortable within a snap, because that's how we can get you really well taken care of throughout a long appointment. Via a pill form, if you were to do oral sedation and take a pill, it could take 30 to 45 minutes to kick in. There's a huge difference in how we can treat you and how we can kind of control the appointment. And then at the same time, I can give you medications for like steroid or an antibiotic or some pain medication through the IV. And so patients who elect for this option are typically way happier than the oral sedation route because it's just more controllable, there's more options, and it's better for longer appointments. So that's to kind of give you a brief overview of what IV sedation is going to be in this practice if administered by a dentist. A couple of things: you got to make sure there's no chance you could be pregnant. You need a driver over the age of 18 to take you here and take you home and take your responsibility hat off for the day, because we don't want you making any big decisions. And then just prepare for a dental procedure, and then to go home and relax and just eat softer foods and just recover. So if you have any questions, reach out to us at Greeley Dental Care. We're here to kind of help and inform. Consider this video high level in terms of what to expect with IV sedation done by one of our dentists over here. We're going to be talking about the do's and don'ts for IV sedation. Just really quick, we want your stomach empty for the procedure. Take all meds prescribed by other physicians unless they have otherwise informed you not to. You need a driver over the age of 18 to bring you here and take you home. We got to make sure that you're really, really well hydrated the day before, because it keeps your veins big and ready to place an IV in versus you being very dehydrated coming in. And then we got to make sure that you've taken all your protocols and talked to everyone ahead of time, so you've made provisions in your life to not have responsibilities once you leave here. I want you to plan on not having anything to do and take your responsibility hat off for the remainder of the day. Even though the meds are going to pass out of your system very quickly and we're going to discharge you still, and you're going to be in good shape, you shouldn't be in any kind of mindset of making big decisions that day.